Hi there everyone, this is Brian Valenciano, and today I have my patient over here, Brian Wong, otherwise known as B. Wong. Today we will be performing the Astrand cycle test, which is a submaximal steady-state bicycle test using heart rate to predict VO2 max. Now, Brian over here does not participate in regular exercise. However, he shows no signs or symptoms of cardiovascular, metabolic, or renal disease, so there won't be any medical clearance needed prior to starting this test. He has been on the bike for about 3 minutes now at a wattage of 25 with 50 to 60 RPMs. Prior to starting this test, we actually tested to make sure that he was of the correct height, which is right at the greater trochanter for him. And we had his vitals measured as well, which were heart rate and blood pressure, 72 and 131 over 72 respectively. Now, we would not start this test if Brian demonstrated any of these, which is a heart rate of greater than 120 or less than 50, a systolic blood pressure greater than 200 or less than 100, or a diastolic blood pressure of greater than 110. However, he does not have any of these, so we are going to increase the wattage and use our heart rate to predict the VO2 max. According to the ACSM, for a conditioned male, he is good at 150 watts, and we are going to measure 60 to 85% of his heart rate, which is 114 to 162 respectively. We'll use this to determine if he is in steady state or not. So, B1, are we ready to go?
Ready?
So, we're going to increase the wattage now to 150. So, we are at 150 now, and for this test, we will be measuring every 2 to 3 minutes, checking for his heart rate. We want to target that 60 to 85%. Biwang, how are you feeling right now?
Feeling alright. This intensity is pretty good.
Pretty good?
Pretty good. It's tough, but it's pretty good.
Alright, and is this your first time doing an Astrand cycle test?
It is.
It is. So, we do want to proceed with a bit of caution. If his vitals are showing any signs of adversely affecting, or if he wants to stop it himself, then we would discontinue the test. But for now, it looks like we're doing alright. So, we'll be doing our readings at minute 3, 5, and 6. At minute 3, we hope to hit that 60 to 85% maximum heart rate, which was 114 to 162. We hit right about 2 minutes, so in a little bit, we'll be checking in. Now, Brian, remember, if at any time you feel like you need to stop, please let me know.
Sounds good. How long is this test supposed to go for?
That's a great question. Actually, this test runs what we want it to be at 6 minutes. So at minute 5 and minute 6, we should see you maintaining a relatively similar heart rate with 5 beats per minute of a difference. After that, we'll be going into cool down, decreasing the wattage all the way down to 25, and having you cool down for about 2 to 3 minutes.
Sounds good.
So we're about to go take a vital, so Biwang, if you could pass me your arm right over here. We're going to check your heart rate. Alright, have you relaxed for a little bit. Now we're going to check for his blood pressure. One more time. Pass me your arm. Perfect. Alright, and relax. So one more thing, we need to check for your rate of perceived exertion. So on a scale from 1 to 20, how are you feeling right about now?
I'm about a 13 right now.
About a 13? All right, so getting into a little bit higher intensity. So we see that Brian is actually right at 148 for his heart rate, which is perfect because that's in the targeted range that we are looking for. So we can continue the test without increasing any wattage. So in about 1 more minute, we're going to be taking another reading. Brian, are you feeling all right?
Doing good.
You think you can keep this up for a little while longer?
Yeah.
All right, you're doing really great for your first time, especially.
Thank you, thank you, thank you.
All right. So it looks like we are just about getting into minute number 5. So we're going to go and do some readings right now. One more time, if you could pass me your arm. Okay, relax right over here. We're going to do blood pressure right now. So one more time, just relax. All right, there we go. And relax. One more thing, just again, we have to check for RPE. So, one more time on the scale, how are you feeling right about now, Brian?
About a 14.
About a 14. Alright, so we're getting a little bit higher. His heart rate this time was at 152. So, we are getting in a place that we are comfortable with. If we can keep it within 5 beats per minute in this last one, then we should be fine. And he should be in steady state. So, one more time, let's take that reading. You take your arm. Alright, and relax. We're going to do blood pressure right now. One more time, we're going to take your arm out. And relax. Comfortable? There we go. And relax. And so, one more time, how are we feeling?
About a 14.
About a 14. But that's great because we are in a heart rate of now 150, which is right within. So I'm going to start to decrease the wattage to 25. That is the lowest on the machine. Brian, we're going to have you cool down for 2 to 3 minutes. Check vitals one more time and call it a day.
Sounds good.
Great job. So, we'll catch you guys again next time. Have a good one. See you.